Hi, I'm Dr. Gina, and a common question that parents ask me is screen time in babies and toddlers less than 2 years of age. Is it safe to use? Can it be beneficial? Is it dangerous for their brains? These are all really common questions. So many organisations such as the American Academy of Pediatrics and the Royal College of Pediatrics, Child Health, WHO have all said that screen time in less than 2 years of age is not recommended. And the reason for this is how babies' brains develop. So the reason for these recommendations is because of how babies and young children learn, especially in those first 2 years of life. So when babies are born, they actually have 100 billion neurons. And in the first couple of years, they're busy making connections called synapses between all of these neurons. And we know that those connections that are repeated again and again are strengthened, and those connections that are hardly used are pruned away, they're broken away. So the way that babies learn is by reciprocated behavior. So they do something, for example, they smile or they squeal, they make a noise or they reach or grab for something. And as parents or caretakers, we respond to that action by smiling, laughing, making a really positive comment. And this causes the child to do it again. And this is how they're strengthening those connections. The problem with screen time is that there is not that reciprocated movement back and forth. They're constantly getting all of these images from the screen and they're going so fast, their brain just cannot interpret or process that information. And when they do something in response to what they're seeing, there's no reciprocated action back, so they're not learning anything from that. So this is why screen time is not recommended in children less than 2 years of age. So one of the main reasons that parents do give screens to their young kids is because they want to keep them distracted whilst they go and do something else. And as a parent, I get this. We have other things to do as well. We can't be with our child constantly, but you don't have to give them something to keep them distracted. It's absolutely fine for your child to be bored. In fact, the more bored they are, that's going to help stimulate their imagination, their problem-solving skills. So if you need to do something, put them in a safe place where they're not going to hurt themselves. Make sure they have lots of toys around them so they can play and interact with their toys. And there's no need at all to put screens on for them. If you don't believe me about screens, then try this very quick experiment at home. Give your child some toys and nothing else and see what they do. Let them play for about 5 minutes and look at all of the different skills that they use. They're playing with the toys, they're interacting, they're looking at the toys, they're moving the toys, they're trying to put the toys together and making connections. And then what I want you to do is put the TV on or put an iPad in front of them for 5 minutes. And what you'll see is they'll completely stop what they're doing and they'll be completely glued to the screen and they won't be doing anything else. During that time, they are not learning, they're not problem solving, they're not using their imagination at all. So don't be afraid if your child is bored. If you have to go and do something, give them some toys to play with, and that's all you need to do to help stimulate their development. Now, I'm not saying that all screen time is bad. The exception to this in babies less than 2 years of age is if they're FaceTiming or they're having a social interactive call with someone. In the time of COVID, it can be really difficult for everyone to meet up with families and friends. And so that social interaction is really important and we don't count that as screen time. I hope you found this video useful. Watch my other videos for information on screen time in older kids. Bye.